Welcome so much to everyone who is here for the first webinar in our 2022 Public Health Webinar Series. This is hosted by the Pennsylvania Public Health Association, and we're joined today by David Nitsch, who is going to give a presentation on a very interesting and relevant topic, the public health implications of the Ukrainian refugee crisis. So everyone knows the presentation today is going to be recorded, and we'll put it up on our YouTube channel in case you need to leave early. Another thing is that David has offered the opportunity for people to ask questions during the presentation as well. So if you would like to raise your hand during the presentation, I can unmute you and give you the opportunity to ask your question out loud. You can also post your questions in the chat, and we will have a dedicated Q&A period at the end of the presentation. So without further ado, I will turn it over to David. And yeah, thank you so much for doing this presentation today.
Yeah, of course. Thank you all so much. My name is Dave Nitsch, and I am super appreciative of having this opportunity to be here. It's we were just talking before everybody came on about the kind of the awkwardness of doing everything through WebEx, and that's why we wanted to be a little bit more interactive and try and be a little more organic with questions and discussion and all that. We'll dive right in. I have just a few slides, and that's why it's appreciative of being the more interactive as we can go. But anyway, so before I get started, I already see a few people that I know from previous lives, previous work experiences. So part of me is super grateful they're here, and part of me is super terrified that that they're here as well. So digging right in. For the next slide. So I really struggled with putting this up here, but a friend of mine that is a much more visual person said to help do this as an introductory slide. And what I'm going to put up here is just a little bit about myself and my background. So currently I am a bureau director at the Pennsylvania Emergency Management Agency. I've been with PEMA for a little under 5 years. It'll be 5 years in December, and I oversee the Bureau of Technological Hazards, and that means that we manage the hazardous materials programs in Pennsylvania, as well as the nuclear power plant and radiological preparedness programs in Pennsylvania as well. In addition to that, I am adjunct faculty at Thomas Jefferson University. I teach a class in international and humanitarian disasters in their School of Health Sciences. Most recently, stemming from my experience in Poland, assisting with the refugee crisis, I am now on an international organization for migration, their displacement and health working group. So that's been a pretty unique opportunity to be able to be a part of that. Finally, I am just entering the dissertation phase of a PhD in public policy. So that rounds out my background and work background and educational background. Now, some of these slides you'll see up here, you can see, obviously, I've been spent some time in other countries, and the child down in the pink was my first experience with a refugee camp, and that is actually one of the pivotal moments throughout my career that really sparked an interest in the idea of displaced populations more broadly, and that's really where I began to generate an interest in that. And that was some focus of my research in my master's program, and still continues in my still framing out the idea for my dissertation, but it's certainly going to revolve around that population, the displaced refugee population, and the like. In terms of the other work that I've done in that space, I spent back and forth between Guatemala prior to COVID for about 10 years, working with some remote villages in the mountains, and again, more of isolated, not really displaced, but certainly isolated and vulnerable populations, providing some rudimentary healthcare and public health oversight. Similarly, I also do some volunteer work along the Mexican border with South Texas with an NGO, with the migrant camps and so forth that have cropped up down there, specifically with in Matamoros and Reynosa, Mexico. And largely the same thing. It's public health oversight, as well as again some rudimentary literal sidewalk clinics that we try and do. So that really rounds out me. And now to get into the meat of this, this is all going to be, these are just some loose definitions, or I'm sorry, some loose objectives we put together, and you can frame all this in the context of Ukraine or in this, the refugee crisis that we're seeing now. So to kind of kick things off, I thought it'd be really interesting, and I don't have the view of the chat, but we're going to do a really quick pop quiz to see to test your knowledge on some displaced populations, refugees more broadly, or the study of that more broadly. You don't need to raise your hand, or I can answer quietly to yourself, and but just some background information will help to frame the idea of what is the challenges, especially in Ukraine, and again, with internally displaced and refugee population more broadly. So currently, throughout the world, what is the number of displaced people? And I'll give a second or two for that, so you can think through that. If you want to share your answers, that's fine. If not, that's okay too. So if you guessed 68 million, you would be correct. That number is probably a little low in actuality. That's 2018 figures. But you can see that the displaced population kind of groups into everything, whether you're a refugee or internally displaced or asylum seeker or something along those lines, but just the general scope of that. So again, worldwide, 68 million people. Among that group is a subgroup of children, and true or false, most of the refugees are children. And if you guess true, you would be correct. So depending on what reference you read, 53 to 55% of that 68 million are actually children. And again, that's the traditional definition, 18 and younger, of what they're calling children that are refugees or internally displaced people. Given the current situation, it's probably a fairly easy answer for this, but the leading cause of displacement worldwide is, by and large, conflict. When we see that, and that has been the largest cause historically of refugee status folks or internally displaced people, and you can see this just in our recent history. Certainly Ukraine, you look at Yemen, you can look at all throughout Africa, the Congo, you look at Syria. So these are all causes the cause of these refugee crises are by and large are some sort of armed conflict. Particularly interesting in this, mortality rates of refugees are half the local population, equal to the local population, or more than double the local population. And the answer to that is, unfortunately, it's about 2.5 times the local population. And there's causations for that, whether it's stress and or poorly managed healthcare, or any number of other, depending on the literature you read. But again, the glaring number is it's more than twice the local population where that group now sits. And once I enter a refugee camp as a displaced person, how long can I expect to be there on average? And if it surprises you, to be over 15 years. So that we know that historically, if somebody enters a refugee camp, by the time their asylum claims are processed or their return to home is actually occurred, it's about 15 years, and that's the average. Sometimes it trends a little higher and sometimes a little lower, but again, on average, it's again depending on what journal you read. I've even seen it high as 17 years. So just kind of a backdrop on when we talk about refugees in general, and but now we'll dig in pretty clearly into what we saw. So this is a personal timeline of events. The invasion of Ukraine happened February 24th. How did I get involved with this? Very much by happenstance. I again, through contacts with a couple of NGOs that I volunteer with, I got in contact or put in contact with a third NGO, and had a conversation the evening of March 1st, and was asked if I was able to depart that Saturday, March 6th. So, and I'd be remiss if I didn't just extol some appreciation for the pulling together of everything. So I am a state employee, and if anybody is familiar with state government globally, we're pretty well known for not doing things quickly, and that is just sort of the nature of the beast. However, the rapidity at which this was approved, and to be able to take 3 weeks off, and in a couple of days was pretty stellar. So I'd be remiss without first recognizing my leadership here at PIMA, and also our office of administration here at the state. So it was supposed to be a 3-week assignment. So we left and came back left the 6th, came back the 26th of March, 4-person team, and we were really tasked with an assessment of need for this NGO and liaisoning with local resources. Nobody was quite certain of what to expect. The information on the ground was spotty, and that is largely because there was no liaison yet. That was part of our ability to be able to do that. We had some loose relationships with local NGOs, and those continued to foster and build as we got on the ground there. So when we first got to Poland, and Poland was one of the central hubs for, and by far the country that took in the most refugees and continue to take in a number of refugees. And this is what we really got into us when we first got there. So these are all photographs I was taken, personally. So these are all not clipped from news sources or anything like that. These are all personal photographs. So what happened? Poland, whether by ended up, like I say, it ended up being the de facto transit hub. Poland is not a giant country, and to have a population of people moving across in days, that is a large chunk of their natural population. It is an overpowering task for anybody and for any country. So essentially what was happening is folks were coming in, and just as fast as they were coming in, they were being moved elsewhere into the EU. Now, how that occurred at the government level, that is a mystery. I am not going to make a guess at how they decide to when, where, how, and who goes to which country and for how long. And we'll talk a little bit more of that later. But in terms of the refugee status as well. What we saw was when we first got there, was about a 3 or 4 day wait simply to enter Poland. And that was because of the volume of folks. And when I look at, when we say virtually no screening of refugees, there was a waiver put in place, as we understand it, as I understand it, for Ukrainian citizens to just bring them across the border. And we can talk a little bit about the challenges with that, and how do you circumvent that or get around those challenges. And then certainly the language barriers between having Americans show up and not speaking any of the local language, not being able to speak Ukrainian, and then having to find those folks that speak Polish and can also translate Ukrainian. Was certainly a challenge, especially if you're looking at a very medically focused mission that you're on. So that was the idea. The other sort of the hardships that were encountered, and that first photo that I put up with the screen actually had a screenshot of temperatures. So it was exceptionally cold at the beginning of March when we first got there, and you see the child in the one photo wrapped in everybody's aluminum blanket, or the once loved aluminum blanket. And then you can see this, the bottom picture is one taking at one of the border crossing, and just the sheer number of folks that were coming across, and having to manage the cold as well. It was This is when I want to be, blatantly clear. There is no finger pointing at the government of Poland. There is no finger pointing at other NGOs of what could, would have been done. This was very much in the the emergent phase of this disaster, and the chaos that ensued from that was handled exceptionally well. Trying to literally manage 5,000 to 7,000 people crossing the border every day is, to say the least, a daunting task. But you can see just by that bottom picture the degree of people coming across the border, and then you couple that with quite literal freezing temperatures, and we had some reports of actually people succumbing to exposure, waiting to cross into Poland. So just another one of those sort of awful layers of when you talk about a refugee crisis in that. So things that we encountered specifically on our tasking, and really highlight some of the great things that occurred. Sheltering was a big thing. What was heartening, and what you see as when in terrible situations you tend to see the good of people. So if you're familiar with Tesco's, I guess they are the European version of maybe a Target. If you imagine a Target store about that size, there was a few of those set up as refugee reception centers. The unfortunate thing about that is, because of the volume, they were pretty full initially. So sheltering was a big issue, get people out of the cold and things along those lines. And you can see that middle bottom picture was the beginning of the Tesco, the refugee center, where we ended up setting up shop, if you will. We liaised with the local government and began to sort of frame out how we were going to provide some sort of rudimentary medical care. So why do I highlight this picture? Because of our non-traditional partners. The folks in this picture are actually students from an engineering program. And one of their, whether it was teachers or a visiting professor or something along those lines, actually came up with this engineering idea for sheltering inside the store. Where they got these materials, I have no idea, but they are essentially the large paper rolls, the cardboard tubes inside large paper rolls is the best way I can describe them. And they ended up developing this idea of basically tinker toy this thing together. They set up a drilling jig and drilled several holes, you can see in the picture, and actually framed this cardboard together, and then draped curtains over this cardboard to actually give the refugees some semblance of privacy, rather than simply stacking cot next to cot next to cot. They set up sort of this pod system, if you will, that's separated by curtains or drapes. And if you needed a pod of 2, it was a matter of moving drapes. And if you needed a pod of 8, it was a matter of taking drapes down. So it kept families together, kept people together, and also provided, a little bit of privacy, just for simple things. Just you want to be away from people for 10 or 15 minutes, or change your socks without having, 800 people watch. So it was one of those kind of head scratchers. It's like, wow, that's so brilliant. Why didn't we ever think of this before? The other thing that was in that top right picture that was kind of alarming, and it's something we see here in the U.S. as well during disasters, is people want to help. And people want to help, they usually provide donations. The sad part about this is we collectively, U.S. and certainly, as you can see, don't have a real good handle on how to manage that. So what ended up happening was, this is the walking transit place from where folks across the border to the buses to take them further into Poland, and folks are just dropping things off. So it's trash bags, cardboard boxes, and things along those lines. And if you needed, a pair of gloves for your kids, you would then be tasked by yourself to sort of rummage through this stuff to be able to find those gloves or whatever else. Similar with volunteers, and to be quite transparent, our little group fell into this as well. We were essentially unrecruited volunteers. The government didn't ask for us. We just sort of showed up and inserted ourselves. We're part of the problem. To be completely honest about it, yeah, because somebody had to take time to manage us. We had to find a translator to be able to talk to folks like that. So, that's certainly an issue to talk about. Plus, it segues into the idea of security and trafficking. Folks from outside the U.S., I would imagine it's a bit easier to vet internal nonprofit organizations and things along those, internal to Poland and things along those lines. But again, there are a number of places that again self-dispatched and we're there, and we're 99% we're doing really good work. The challenging thing was the trafficking and security part of that. That was something that was very difficult to wrangle, and I can't say for sure, but it was certainly, and we see this in the U.S. as well, that we have to be cautious of congregate care when we put a bunch of people from a bunch of different places into a congregate area. We have to certainly concern ourselves with that idea. And that's something to remember when we talk about more broadly just displaced populations. You have to remember when we talk about displaced populations, you're taking a segment of a society and transplanting it somewhere else. And it is not accurate to think that all those folks coming are air quote, good people. You're going to have, some level of criminality in that. You're going to have every issue with our population broadly that's going to be segmented down, by percentage, but it's certainly going to be part of those groups that you may see. One kind of disturbing quote that was by the United Nations High Commission for Refugees. It's impossible to know how many refugees from Ukraine have already fallen prey to traffickers and other abusers. And again, this is not pointing fingers at the Polish government. This is to highlight that, yeah, this is a problem, and how do we address that problem, and not just within this community, but again, we broaden this out a little bit. The other thing that was pretty glaring to me, and it was one of those things that kind of sticks with you personally, is the degree of dignity among those folks coming from the Ukraine, and that's not something that we tend to discuss enough. And not to go too far down a rabbit hole with this, but one of the subpopulation we started talking to, if you will, were school teachers. And the reason we started talking to school teachers is because we don't speak Ukrainian and or Polish, and they certainly spoke much better English than my Polish. And just hearing those few stories, and imagine, if you will, put yourself in a position now that I was a school teacher at the beginning of February, and now in early March, I am rummaging through somebody else's stuff they dropped on the side of the road to try and find a pair of clean socks. And how do we, and that destruction of personal dignity under the guise of helping, and again, I just circle back to, I'm not pointing fingers at anyone in particular. These are glaring problems that occur at every refugee crisis that we run to. This was just certainly more highlighted being a part of that. And then the traumas that are associated with this as well, and not so much the physical trauma that we one of our misconceptions, I'll say, was that we were going to see a lot of trauma, simply because of the nature of the displacement, and that just wasn't the case. The folks that couldn't make it to make that trip were by and large pretty healthy. There were a couple outliers, but certainly we didn't see any of the traumatic injuries that they were seeing further inside of Ukraine. So yeah, those are the top tier issues, and we'll continue to speak on that as we go through. And the next slide I'm going to share is just a quick story. So, or a quick two stories. So, Tanya and the little boy in the gray sweater. And Tanya is a 15-year-old girl that we met on the border. She spoke English very well, engaged us in conversation. She was looking for directions to get to the buses to take her into further into Poland. Her parents stayed in Ukraine. They put her in a jacket, packed a backpack, gave her some cash, what they had in the house, and sent her on her way. And it was, keep your cell phone charged and so on and so forth. As we began to talk to her, we realized that Tanya had no idea where she was going, how she was getting there, other than to find a bus and get on it. And being the dad of three daughters, it was a particular interest to me. Even something simple as, where are you staying tonight? Where are you eating? None of these questions could be answered. And that's just, again, to demonstrate the level of need. And it was very clear by her expression. She was teetering on the verge of tears, but held it together better than I would have, probably in the same situation. So we talked to her for 10 or 15 minutes, made sure that she knew where she was going, and then realized when we again started talking, all her cash was Ukrainian. So she would either have to, and they tell you not to do this, because it sets up a precedent that can't be continued. So we pulled some cash together that we had in Polish zlata, and I'm sure I'm butchering that as well, but Polish money that we had. We pulled that and made sure that she could eat and get an Airbnb or something for the night, or paying cash, and that was it. So that's kind of just that level of even helplessness, I think, is a good word. I don't particularly care to use it, but knowing that we're there to try and help, and wasn't a ton that we could do for that. And then the little boy in the gray sweater, don't know his name. He didn't speak English. His parents didn't speak English. But he, came into our makeshift clinic with what we interpreted as belly pain. I'm trying to do an assessment on this little guy. And it was pretty clear that what he wanted to do was sleep. So he folded his arms, under his head, and I ended up rocking this kid for about 15 minutes and just letting him sleep. And that was, probably one of the more impactful things. And it sounds crazy that you jump on a plane and fly 8 hours away, and what you end up doing is, rocking a little boy to sleep, and he was probably 4 years old. So those were the human side of really being this that was pretty impactful for me when you look at that. So yeah, looking at the specific public health impacts of what we saw over there, the interesting thing was, again, these are not new. This would also look pretty usual for folks in the public health world. The WASH initiatives, again, the trying to do this for a massive transient population with limited resources is a staggering, overwhelming task. And you think about something as simple as sanitation and hygiene. I'll say simple as that, sanitation and hygiene. But you take you're put in a context we understand, and the Target analogy. How many bathrooms are in a Target, and then how many folks can you pack into a Target when you see how close the cots are? So trying to keep bathroom facilities clean and updated and working properly was monumental. And who do you get to do that? And when you get those people to do that, what aren't they doing in their day job? So what is being sacrificed and the like? And then so that was a pretty daunting task to try and creep up with that. And then the simple things that we also talk about in the WASH initiative, that upper photograph was right outside the dining area, we'll say, at the Tesco, the refugee center. You can't really see it that well, but there's next to the yellow trash cans are two small buckets where the folks scraped their leftovers and just kind of sat there. And the same thing. So trash bags weren't able to be provided and things along those lines. When we first got there, not even a hand washing station outside of the dining facility. And again, this is not pointing fingers, but when the folks in charge of this transition from a Tesco/Target to a refugee reception center were not public health folks. They were logs folks, they were planning folks, they were businessmen that were able to bring additional resources, and eventually, National Guard folks, or the Polish version of National Guard. I'm not sure of the correct title for that, but certainly men in uniform, people in uniform that were there. And all those other things. Now, what I will say is the ingenuity and having people look at things with a different lens. So the young man in charge of this Tesco, when I say young, 27. He was put in charge of this through the local government, and just started making phone calls and got things prepared. So called plumbers and had showers retrofitted into the loading dock area of behind the mall, or inside the mall, but behind where the shopping goes on. Additional rows of sinks he had installed and things along those lines. So it was he managed to bring in toilet trailers and shower trailers. So it was a tremendous undertaking, and this young man was tremendous. So that kind of looks at our WASH initiatives, the nutrition aspect of things, and again, under the umbrella of I want to help. You have folks that want to help from every walk of life. The challenge with that, and you see this again back home as well here in the States. When there is a problem, what happens? And it's usually somebody will donate 20 pizzas, or McDonald's shows up with bags and bags of free food, or the fast food place du jour that happens to be there. And that's all well and good. That'll certainly fill the void for the time being. But the problem was that we saw pretty short order, especially with the kids, was you have a couple of days of lollipops and pizza crust, and everybody's got GI issues. So everybody's constipated, everybody's nauseous. Then you layer cold and fatigue and stress on all that. So that was another challenge. Now, this was managed quite handily. Probably about day 2 or 3 there with the World Central Kitchen, and not to, I swear I have no financial benefit with World Central Kitchen, but they are a tremendous asset, and they not only it's not just they provide food, they provide nutrition, and I think that's a very clear distinction to be able to do that, and was able to do that with rapidity, and certainly it was decent food to be able to support this, and tremendous volumes of it. Now, the other thing is that circles back into the sanitation and hygiene of this, because everything comes in disposable containers. So imagine the waste that 5, 6, 7, 800 people can produce in a day. So simply, again, managing the sanitation of that and the waste of that is a full-time job for somebody. So other things that we see are vaccine preventable diseases. If you start to read things now, the working group I belong to, they said there's tetanus that's cropping up, diphtheria. COVID has not been, or wasn't a recognizable problem for the short time I was there. The interesting thing, Ukraine didn't have a great vaccination record. The other interesting thing about Ukraine, we started digging in and trying to figure out, is there any long-term illness that may happen? Well, it turns out Ukraine is the number 4 country in the world for tuberculosis. So that was an interesting understanding and realization. And then as the public health person in me started thinking through that, I was like, okay, so how many of these X million people have active TB? and how when we're not really screening any of these folks. And now we're distributing those folks throughout the EU. So it doesn't take long to get to the path of, are we going to start seeing TB start to have some prevalence throughout EU? Is there going to be pockets of TB? I like to think I'm wrong, but I have to figure that somewhere in those millions of people, there is some active cases of TB. So some long-term surveillance, and again, I am certainly not privy to the workings that are continuing, the workings that are going on. So there could very well be some long-term surveillance measures being put in place or already been in place. But these are just one of those head-scratching moments that we can learn from and maybe take back for when this happens again. And certainly mental health needs was probably one of the, if not the biggest challenge that we talked about. And it's not necessarily, we'll take this mental health needs down two paths. Certainly the stress of being uprooted from your home, not knowing where your parents, not knowing where your conscripted husband or older son are, and having to have other children in tow and not knowing where you're going to live or where you're going to get your next meal and things along those lines. So that level of mental health needs. And then we have to look at the mental health needs with folks that had some level of mental health challenge prior to that. We ran into a young lady came to our clinic who was terrified. She was diagnosed schizophrenic and had it controlled. Taking whatever medication she was taking, and it was very difficult to translate everything from, especially the medications. But her big fear was she had 2 weeks of her medication, and she didn't want to. She wanted to go off it. So how do you fix that, and how do you keep her on that same drug? So just a huge challenge or a huge mental health challenge. And again, nothing that is earth-shatteringly new. These are all deep concerns that continue throughout any refugee crisis that we run into. So the other thing we looked at are just really the striations of the patient population, or the person population. I'll try and keep out of the medical field. So again, the folks that were making that journey, by and large, were pretty healthy, and because of the conscription of folks staying in Ukraine, elderly, female, and children were the folks that we were seeing. So that was, and they, again, fortunately, they were all pretty healthy, and I have to tell you, the resolve, they are, painting with a broad brush. A hardy stock of folks. I had a discussion with one lady that came in, and she wanted, she's aches and pains, Tylenol, Motrin was something for her knees and back, and take her blood pressure, and it's just off the charts high. And she just kind of waved us off and said, "Yeah, okay. It's always been high. I'm here for that. Can I have my Tylenol now?" And just very hardy stock folks, and pretty impressive given the situation with that. The other things that were interesting is we had the ability to take a step back and again put on different hats. Are and this is an observation, not an accusation, but the health and wealth disparities that we saw through that. So folks that could drive drove. Folks that had friends, relationships, the ability to pay for hotels or Airbnbs or something along those lines, were able to do that. And again, very similar to what we see, whether it's an evacuation from a hurricane here in the U.S. or this massive displacement because of war in Ukraine. It's just interesting how how that all breaks out pretty evenly across countries and across initiating factors. So losing sight of the trees. Why did I put that up there? You hear that don't lose sight of the forest for the trees. Well, sometimes we tend to lose sight of the trees. And I think we need to really take a good look at that. And I put these 3 bullets up here. So bureaucracy, and I'm not suggesting I'm not putting that up there as a a dig. I'm putting it up there as something that we have to understand when we talk about this. So again, I show up with myself, my three colleagues are all physicians. And it was probably a little bit into day two that the idea of licensing came up, and we realized, oh yeah, this is not a village in West Africa that we're pretty far insulated from having to worry about licensing and the ability to treat people legally and all. And this is Poland. They have everything that we have, including the need for licensing. So it turned into, for a time before this actually got figured out, something along the lines of, I'm not your doctor, but if I were your doctor, I would tell you to do A, B, and C. The other thing we have to realize is like we spoke about earlier, is we were guests in this country. That's a difficult thing for, and take this for what it's worth. It's a difficult thing for Americans to realize sometimes, that we are guests in other countries. It's very difficult when we don't understand the rules to play by those rules. And that's just I think that's a factor of human nature that was challenging to be able to say the least, to realize that we have no real, again, the Polish government didn't ask us there. We showed up and said, hey, we're here to help. And then, through a little bit of luck, a little wheeling and dealing, and some handshake agreements, we managed to carve out a place and did some good work. Eventually, there was the Parliament passed essentially a waiver process to be able to do that, but it was fairly urgent legislation to push through. So it was, it didn't take long for that to occur, but. One of those things, again, when you have 1 million people flooding into your country, is making sure that American doctors can practice a high priority list, and it just wasn't. So again, hats off to everybody that were doing 18-hour days for a long time at every level of government for that. The assignment tasking, this is one of those things that shifted daily, and it really got in. That kind of segues into mission creep. So what are we there for? And then what do you end up doing? And what are these things that you could end up doing? I will relay just as an example and kind of drive this point home. There was a very large nonprofit that actually set up a large hospital in Ukraine. Again, under the idea that there's going to be trauma. So it was a surgical hospital. It was ICU, surgeons, surgical suites, something along. If you're a former military person, those inflatable tents that you would see deployed around the world. So lots of resources, lots of funding, lots of people that were there to support that. They didn't see any patients into this trauma facility, because it was the idea of, well, we're going to set this up, and under the if you build it, they will come model. Well, it was pretty clear that was not really the case. So again, finding out what the need is, and tasking appropriately, those are things to take away from all this. So pulling back a little bit from Ukraine and Poland, and talking more broadly. So again, this illustrates that this really, the current landscape of things around the world is pretty similar to what we've been talking about. What are the needs? Many different analyses have gone on over time. These are all very recent articles that I just clipped, just as an example to do this. But again, unfortunately, I wish I could say that the cases we saw and then the issues we saw in Ukraine and Poland are isolated. But when you talk about the refugee internally displaced population, there's a lot of parallels that can be drawn with that. So again, for the latest numbers, I pulled these numbers April 20th. We have for Ukraine 7.2 million internally displaced people, 5 million refugees. and 12.6 million people that are stranded or unable to leave because of the conflict. Are trapped somewhere within the boundaries of Ukraine. There's a portion of those folks that may not want to leave, but I'm sure there's a portion of those folks that will leave and are just unable to get out of the violence. So, what do you do with all this? This is a quote from Einstein, and there's a lot of truth to this. A problem can't be solved; the level was created. Kudos, and I will say this to the local governance in Poland, and again, similar. If you would look at the emergency management model, every crisis is local. The ability to have those resources, the ability to have those relationships, the ability to and the authority from the local government to trusted partners, I think is one of the greatest takeaways from all that. And had that not been available, would there be increased mortality? And I don't have a crystal ball to be able to say that, but I think it's the likelihood of that is pretty certain. Certainly everything was not without flaw, but this is one of those cases where you're quite literally building the airplane while you're trying to fly it. So things evolved, things got better, things that didn't work were shifted. And, for as bad as the situation was, I think it was handled with tremendous grace, tremendous dignity by the local government that we ended up working with. So with that, key takeaways from all this, what we address what we already know, and this similar things that we talked about already. The mental health aspect, I think, is huge. They were, and it doesn't need to be, anything high tech. Although there was, there's certainly the ability to do that. What I found interesting, especially with the teenage population, was everybody's got a smartphone, and Snapchat is just as popular among that age group and among those folks as it is here. So it was as many things were different. It was kind of fun to see that the things were also pretty much the same when you talk about groups. So yeah, taking this information and being able to do things with it, if I put on my emergency manager hat for a second, learning from this disaster, so we're not repeating these same mistakes. Traditionally, we in the emergency management field, we tend to plan for our latest or our most recent disaster, and we can certainly take a look at these overlays and say what are the things that are consistent across all of these issues, and certainly begin to put plans in place to be able to address that. Hopefully, I would like to be able to say there's never going to be another refugee crisis ever, but that's never going to happen. As long as there are people that are going to argue over boundaries, or people are going to argue over space, or people are going to argue over things that somebody else has. So I tend to think we're not going to get out of that anytime soon. Certainly, governments and nonprofit or non-governmental organizations need to work together. And I wish I would be able to say that was the other challenge I saw with the NGOs is the duplication of service, duplication of resources, and things along those lines. So, and I don't have a great answer to that, but how do you curtail that, or how do you channel all those resources to be able to come out with a better outcome? So that's it. So it is it's 11 something 51, or I'm sorry, 12:51. Are there any questions, comments, anything else that we can discuss?
If you have questions, feel free to unmute yourself or post a question in the chat and I can read it out for you.
So Brooke and David, are you guys okay if I do a quick question? I know we have some students in the room, and some young people, and you've had a really interesting career trajectory that has led you to developing this expertise. And just don't know if there's anything you can say for me, for other people in the room about, if we're really interested in this type of work, how you set off on this path, and how you built this ability to do this work in the way that you do it, which I think is really unique and interesting.
Yeah, I have been, and I've been very fortunate. While I was in the moment, I didn't realize this was everything was coming to this. But like I said, and one of my actually one of the people on the call I was overseas with, so it was um, uh, just being, and I hate to say, is being in the right place at the right time. I had a conversation while I was in Iraq about public health, and as a medic, I had no idea what public health was at the time. And that was one of those those aha moments, a simple, cup of coffee conversation with somebody that was brighter than I was, and I said, "What is this public health thing you speak of?" And talking through that, and that was what prompted me to learn more, and that's actually prompted me to go back to school. And if there is an interest in the refugee crises, if there's interest in international or global health, there are a ton of resources available out there. I'm a big fan of, and again, no financial interest. Relief Web is a great website for lots of things, for information. They have a jobs board. There's internships all over that. You have to segment it out, line it up with the semesters. The other thing about this is it's quite surreal, because if you asked me 10 years ago, would I be giving career advice to anybody else? I just so no. If you get advice from me, you're probably going to end up drunk. But that's where we'll go with that. So I'm actually flattered to hear you say that. I wish I would have started earlier. So for all the students, just go ahead and roll those dice. There's the only thing that beats a trial is defeat. So just go ahead and look for internships, or look for volunteer organizations that would be more than happy to have you be a part of things. And it may not be the exact fit that you want. Some days, or some of the times when I go to Mexico and Guatemala, I'm outranked medically. So there's plenty of doctors, there's plenty of PAs, there's plenty of nurses. So I end up counting pills. And restocking and things along those lines. So it's, would I rather be seeing folks and engaging in, but it's like, but that's also important work too. So just broaden your horizons like that, and it's great stories to tell. It's great experience to be able to do that. So without rambling too much, that's what I would say to all those folks.
There are some questions in the chat, so I will read those out. We have from Tina. You mentioned issues surrounding appropriate donations, human resource management, and realizing that you're a guest in Poland and having to follow the rules and regulations of host countries. My question to you is whether or not there was big involvement of UNHCR guiding the process while you were there, and if so, how those guidelines were implemented.
Yeah. So the issue with the simple answer, well, it's a yes and no. So the UN was absolutely there. The challenge with bureaucracy is its bureaucracy, and what I mean by that is, so you draw a pyramid, and you have the decision makers at the top, and then the boots on the ground folks at the bottom, and how do you get the information, the funding, the resources from there down to there? And again, I would love to be able to say that this is that's something new, but it's not. You look at anything domestic, and what the issue is. When you get government bureaucracy, the thing you also get is time, delay in time. So you look at here in the U.S., and when something terrible happens, we'll pre-position stuff to be able to handle that emergent phase of things. But when we start talking about the day 10, day 15, something along those lines, all that stuff takes time, and that's something that. So, and answer your question, yes, they were. For the short amount of time that I was there, the level of involvement wasn't much. And again, that's just because it takes time to get folks in the right area to be able to do that. That's not a dig on the UNHCR. That is, how do you get people from around the world to a place, to get them spun up, to get them, and all those behind the scenes things. Where are they staying? Where are they? How are they driving there? Where are you getting your laundry done? All those things have to fall into place. So I would imagine there's a much bigger footprint there on the ground now. Not imagine, I know there's a much bigger footprint on the ground now, just in a couple of conference calls I sit in on. But again, it's a matter of time, and all while you're still trying to manage 5,000 people coming across the border.
Thank you. We have another question in the chat from Eli. Eli asks, how is the refugee crisis in Ukraine unique compared to other refugee crises like in Syria, Afghanistan, Palestine, Hurricane Katrina, etc.?
So yeah, I could probably write a thesis on that. How is it different? It's vastly different, and it's eerily similar. I was able to, I spent some time in Jordan, so I got to, when I won't say tour, I got to visit one of the Syrian refugee camps in Jordan, and it's the exact same thing that you see. The issue is, like we talked about at the beginning, that 15-year window entering in, and the Syrian refugee issue is 11, 12 years old now, and you still have people living in those camps. So I wish I could say it's different, but it's not. I think for right now, Poland is still, and Poland, Romania, Ukraine, certainly, they're still in that crisis phase of this. They're still having, and again, I'm speaking anecdotally. I would imagine that the tide of folks coming into other countries has maybe slowed a bit. Certainly there's been there's been time to bolster resources and things like that, but that's another important distinction, is how long can that be kept? How long can that pace be kept up? And that's a real life concern. You start to see like week 3, week 4, and this is somewhat anecdotal, somewhat evidence-based, you get volunteer fatigue. So how long can I be away from my job? I was, again, exceptionally fortunate that I was permitted to leave, and I will always be grateful for that. But how many people have the ability to leave their job for 3 weeks to go do something else? And then how long do those resources run out, and things like so? This is a protracted event, and do you now? And Jordan saw this as well, and I imagine Poland and other EU countries are going to see this as well. How much of a challenge is it to try and absorb extra million people into your economy, into your housing, into your job market? How do you take care of those people in 6 weeks, 6 months, 6 years? So that's the part of refugee crises that don't get discussed enough, is the now what phase. Things have stabilized to some degree, and they're not getting as many migrant folks or migration of folks along, and now you're looking at the now what. So how do I educate those folks? How do I feed those folks? How do I house those folks? How do I put them in the job market? And those are just cascading impacts of this event. So I hope that answered your question, Eli.
Thank you. And it's 1 p.m., so we will wrap up this webinar now. I just wanted to, again, send the thanks to PPHA, to Dave. This was such an informative and thoughtful discussion of your time in Poland, helping the Ukrainian refugees. And thank you to everyone who joined us today. If you're joining us and you have an area of expertise in public health that you would like to share with PPHM members, or someone who does, please let me know, contact me. We would love to be able to share the expertise of other Pennsylvanians. So thank you, everyone, and have a good afternoon.
Yeah, and let me, everybody, again, public health, PPHA, thank you so much. That's my email address. If anybody has additional questions, feel free. And I truly appreciate the opportunity to be able to do this. So thank you all very much.
Great. Thank you.